You are watching the Doctalk show.
Welcome back. Before we went for the break, we were discussing substance abuse, especially alcohol, which is the most commonly abused substance globally. And we discovered that some people might be at risk, especially if you are genetically predisposed and have a positive family history of alcoholism within your family. But I want to know, what are the effects of abusing substances? What are the complications it poses to the person who is consuming them? Dr. Diana, please start us off in this part. The complications, if someone is hooked to a particular substance, let's say like tobacco or marijuana, what will happen to them? What are the complications?
I'll start with alcohol. So it affects nearly every organ in the body. There would be effects on the liver, especially. This is when you start getting, yellowing of the skin, bleeding patches on the skin. So it definitely affects the liver and can also affect the heart as well. And this is what we call alcoholic cardiomyopathy in medical terms.
Basically, the heart becomes big for some reason.
Yes, yeah. And it can also affect the brain. It does affect the way someone walks, and it affects the area that's responsible for balance, called the cerebellum, just at the back of the brain. Lots of other complications to the nerves, also affecting the way one walks eventually. Cognitively, it can affect the way we make decisions. A lot of times people make very poor decisions despite the fact that they've lost everything, they continue to drink, and also despite the fact that the alcohol has affected their bodies, they continue to drink. It can also affect the pancreas. It can lead to a condition called pancreatitis. In medical terms,
pancreas gets burnt, and it's quite a very it's quite a medical emergency if the pancreas goes into very severe disease. So that's basically alcohol. Alcohol almost knocks out every organ in the body. What is it like, Dr. Hillary? What is it like in these other substances? Do they have the same effect on potency as alcohol in causing widespread organ damage?
Oh yeah, not only organ damage, but fatalities as well.
Yeah, people die from them.
Exactly.
Okay.
Things like alcohol, we come in contact in our daily practice every day. For example, the physicians would be treating pancreatitis, but that has resulted from alcohol use. But it's something that you will not even think about. You'll see pancreatitis as it is and treat it. But if you if you go back and find out where it originated from, you always find that it could have come from alcohol. But if every doctor, you may drink, like she says, it affects your cognitive abilities, your memory, your judgment, your responses, and you end up in a road traffic accident. You break your legs and you end up into orthopedics. So we come to these substances every day. The other substances that they have that we also encounter include opioids. Or opiates. We encounter these, we shall find that they come with wounds from injection sites, or even when they also used, they also get all these signs and symptoms, like you feel high, you feel like you're on top of the world, and you take risks. And you will end up with the other injuries or medical conditions that will actually make you lose your life as well. Okay. Like the biggest mortalities we get in substance abuse is from secondary complications, especially like road traffic accidents, fights, shootings, all those kind of things, all murder or manslaughter. But in opioids, we can get overdose, and then you end up dead.
Okay, just like some of the artists or celebrities were on the news who take certain substances, and before you know it, they have drowned in the bathtub or something like that. Yeah, so self-injuries to the body are one of the biggest complications people who are addicted to substances may experience, but also not forgetting certain notorious diseases such as lung cancer, which is directly or almost exclusively linked to smoking tobacco. So if you are smoking tobacco, please bear in mind that your risk for getting lung cancer is steadily increasing the longer you smoke that tobacco. And things like even liver cancer or even hypertension has been, high blood pressure has been linked to opioid use, excessive use of injection drugs. So all
kidney
these
failures as well.
Yes, and as well as knocking out the kidney.
Exactly.
So these substances have very devastating effects on our body, and it is of paramount importance that if you are the person who is addicted to these substances, you must find a way to stop consuming these things so that you can be able to save the health of your body. Which brings me to the next question. So if someone is abusing alcohol, or is abusing, not even alcohol, we are saying alcohol because it's the most commonly used substance, but how can one know that maybe their child or their relative is abusing the substance? How can they know in this case?
They probably are not showing up to work. If they're going to school, they're not going to school. And they're not doing the things that they should be able to do every single day. And also, if someone finds that they are requiring more and more, higher and higher amounts to achieve the same effect, they're developing a tolerance, saying that at that point, that is excessive use and it needs to be checked at that point. And the other
tolerance, now it is tolerance. That is now a new term, yes.
Okay, so that is when someone requires more and more to achieve the same effect. So say someone's drinking 2-liter bottle wine for about 3 years, and then at some point finds that the 2 liters are not giving them the buzz that they used to get. And then they find out that, 3 liters will do or 4 liters will do. So that is tolerance.
So they keep going up,
Yes.
up. Basically increasing the amount they are taking to achieve that level
the same
high.
Effect.
This level high.
Yeah.
Okay. So, Dr. Hilary, if someone reaches that stage, is there any way back for them?
Yes.
Or they just continue that trajectory?
Yes, there is hope.
Okay.
It's not that when you have reached that stage of dependency, you're gone. No. The most important thing is understanding the effects, because by the time we get to see them, probably they are paupers, they have lost their jobs, they have broken relationships. They are basically nothing compared to how they started when before they started abusing. There is hope. There is a treatment for these substances, almost all substances. There's a medical treatment and the other treatment, what we call psychotherapy, also commonly called counseling. Almost similar, but there is a difference. So all substances will have certain drugs to help reduce on the treatment, as well as to help them identify and understand the substance that is being used and how they can help and avoid them.
So where can they access these treatments? Do they just walk into any hospital? Do they have to go to Butabika? Where are these treatment centers?
There are so many treatment centers, also called rehabs. But again, by the time you reach a rehab, like doctor was saying, there are many physical symptoms. Many times we shall first identify these people due to the medical complications they present with. In the hospitals where we work, we just need to understand the source of these medical illnesses we get and help them from there. There's what we call brief interventions. This is when we interact with the patients, keep giving them information on the dangers of using the substances and where to get help and how to get help. But again, there are other treatment centers. Of course, Butabika is there. It is the biggest mental hospital which treats all substance use disorders as well as other mental illnesses. There are other private treatment centers, including DIMFNA, that treats mental, neurological, and substance use disorders as well.
But how long would this treatment take? Is it kind of a brief treatment such as a treating malaria, or is this basically a lifelong treatment?
It is in stages, depends on at the level you come in. There are those who come intoxicated. Those ones, maybe you treat the intoxication and you're sent to rehab. There are those who come in withdrawal. Those are who we call addicted now, where without the substance, they cannot function. So we have a term called the detoxification. Those ones, we admit them and help them be able to recover from those substances.
Kind of detox from those substances.
Exactly. Okay. And then we send them into rehab. So the time you spent in rehab varies. Many rehabs give a timeline of 3 to 6 months, but again depends on the personnel there and the skills that they possess in managing these substances.
But on the general, I think rehabilitation from substance abuse takes a long time.
Yes.
And therefore, it reflects the importance of prevention. How can you prevent your child or your relative or your friend from getting addicted to a substance? So more about that, come in right after the break.
You are watching the Doctalk Show.